if you actually fully understand the neuroscience behind the perfect storm and what causes kids to get sick, those secondary and tertiary dysfunctions of retained primitive reflexes, brain hemisphericity issues, incoordination, visual accommodation challenges, those are all secondary compensatory mechanisms from, write this one down, subluxation. All right, chiropractors and chiropractic students, welcome to the Family Practice Podcast. You know, the one you've been waiting way too long for, because this podcast will actually stay focused on chiropractic. Not only what it takes to get world-class clinical results for kids and families in your community, but also what it takes to build a legendary, incredible family practice that takes care of your family way beyond your dreams. I'm Dr. Tony Ebel, and I'll be joined by Dr. Matt Hill, Dr. Ellie Wright, Jackie Jakubowicz, and incredible guests, chiros, associates, CAs, all these folks making massive impact around the world. We're going to cover everything: pediatric, perinatal, family practice. This is the podcast you've been waiting for, because moms and dads and families have always needed us. Now they're finally ready for us. I hope you're ready for the Family Practice Podcast. Let's go. All right, my friends, this one will speak right to your heart. I've got a straight fire solo episode of the Family Practice Podcast coming at you right here, and it will be a perfect message for you if you are still a principled chiropractor with a pulse. If you have sold out to all the coaches and Instagram influencers and seminars and immersions that talk only about profit and only about freedom and only about you as a practicing chiropractor finding the easy road, well, then maybe this one's not for you, because I truly know that's the truth. This is not for everyone. What we're going to tackle here with this episode is the exact must-dos and must-not-dos to take on tough neurological cases. Now, I'm going to speak mostly to tough perfect storm pediatric cases, because that's what I do all day, every day in practice and have for 17 years. But when you master taking on tough pediatric cases, you are also equipped and ready to take on tough perinatal cases and tough any cases, period. Our practice always is starting intensives and in-depth, really serious care plans and taking on tough adult cases, whether that be Lyme's or fibromyalgia. Who cares what the diagnosis is or the condition is coming from the medical description? We know that we're dealing with many, many layers deep of subluxation, neurological dysfunction, dysautonomia, dysregulation, brainstem damage, vagus nerve damage. You talk about it neurologically in terms of subluxation patterning and subluxation severity. We've done an episode, Dr. Matt and I, here on the Family Practice Podcast, where we blew your minds with the 3 progressive stages of subluxation, where we move from sympathetic dominance and parasympathetic exhaustion, that initial dysautonomia stage, into neurological disorganization and incoordination, as the chiropractic textbook, Dr. Stevenson and Dr. Palmer way back would have put it. And then today, you are practicing in a time period where you need to be prepared to take on more tough cases than ever before. Because with no matter the style of your practice, even if it's honestly a standard back pain practice, you're dealing with more severe cases, more stage 3 of subluxation progression, neurologically exhausted and neurophysiologically depleted, freaking not adaptable, not resilient, not even close people across the entire family spectrum like never before. And if you wanted a recent, not fun, but real life evidence of how severely, significantly subluxated and sick the current practice population is, take a look at COVID. Now, the cool thing about that is it actually shows that even though kids are sicker than ever before, chronic illness, autism, epilepsy, asthma, allergies, autoimmune, ADHD, anxiety, depression, even though there are more tough pediatric cases than ever before, and you need to do the things we're going to teach in this episode and get better, the coolest thing ever is that kids get better, easier, faster, and fuller because they're more resilient. COVID actually taught us that too, because COVID is just, it was a virus that took advantage of those with chronic illness and late stage dysautonomia, third stage subluxation, because they had no resiliency, they had no fight, they had no adaptability left into their neuroimmune systems to handle that. And that virus attacked that. So long COVID would fit this conversation. You are seeing tons of adults who are absolutely neurologically depleted. They are dysautonomia. If you run HRVs with the insight scans like you should, they're in the worst freaking quadrant. They're in the worst zone. They're completely shut down and exhausted when you run your HRV. That's the conversation we're having today. But I did just kind of poke the bear a little bit right out of the gates to say, this is only a conversation that's going to excite you and engage you and get your notebook out and be like, I need to know what Dr. Tony knows about taking on tough cases. If you have a give a crap factor yet. By the way, let's just talk about a couple of more truths before we get into the 5 things you got to do and the 2 things you absolutely don't want to do to take on tough cases. I'm going to get very strategic, but first I'm getting very kind of calling chiropractic to the mat and saying, are you on the field or not? The old, I believe it was, probably going to get it wrong, it's going way back, Teddy Roosevelt quote about the man in the arena, and says, when you got into chiropractic school, did you sign up for chiropractic school? I wish they would actually make us, I wish it was harder to get in, and they would actually make us write an essay to get into it. Maybe some schools do, I don't know. But I bet in your essay you didn't put in there, man, I cannot wait to only work 3 days a week or 2 days a week and make a ton of money and look cool. I don't think that was your essay that would have got you into chiropractic school if they asked anyways, and they actually gave a crap. You got into chiropractic to get sick people better and to keep healthy people thriving. That's what I signed up for. I didn't come in solely for profit. Now, when I say that I need to call people out first, if you're chasing profit and status, it's not that means you don't go after that too, TOO. But if you go after that first, and you're not going to give a crap about this episode because you're going to be scared out of your mind to take on tough pediatric cases like autism. A lot of people, here's the excuse I get all the time with the perfect storm. I don't want it to. I have a really awesome family wellness practice and kids with autism and everything else. They're tough to handle. They disrupt the flow of the practice. Yeah, because their life is freaking disrupted to such a degree that they can't handle much of anything. And the only thing, and I mean this, I could teach you the science on a different episode, the only thing that can go deep enough and full enough to pull that child out of the storm so that they could handle your waiting room, so that they could handle Target, so that they could handle going on vacation with their family, is if they had a badass chiropractor who fully invested in adjusting them and taking care of them. So I've heard every excuse in the book as to why to not take on tough cases, and I've never bought into a single one of them. I've always had an experienced, heart-centered perspective that I could share to get you to the other side of them. But you got to care enough. You really, truly got to care enough to be able to say, I want this. I want to go after tough cases. I care that much that these kids, these people are struggling that much with their health and their well-being. And I'm ready to step up, get better, and get after it with this list of 5 things to do and 2 things to not have to do. And you're going to really find freedom in that list of 2 things that a lot of people think, if I'm going to take on tough cases, I need to do this and that and everything else. No, I'm going to fry those fish plural, for you deers, mooses, meese. No, just kidding. We're going to fry those 2 for you as well. But there's one more table setter before the list of 5. I said there, you got to get better. Here's one more chiropractic across the board truth. We all need to humble ourselves with excitement and admit and take on. We're actually not that good clinically because chiropractic school does not prepare us for tough, complex cases. Did you have a class in chiropractic school that was complex, pediatric, intensive neurological cases? I didn't. Did you have a class in school that went beyond straight leg razor and foraminal compression and how to take care of low back pain and standard spinal stuff? I really didn't. So I don't want to be the only one who's raising this sign, guy with a sign and saying, hey, we're good as a chiropractic profession at standard stuff, spinal care. There's actually a great podcast. I believe he just celebrated his 500th episode. We're only at like 50 or something with the Family Practice podcast here. Dr. Jeffrey Lamade, the evidence-based chiropractor. I actually love all kinds of chiropractic. I love everybody of every condition of anything getting drug-free, non-surgical results through chiropractic, getting back to a kick-ass life, and then maintaining and promoting that life through lifetime chiropractic care. I don't care if that's Bob with back pain or a little baby with colic or a kid in between stuck with autism. autism, or even better, a child that never went through any struggle. We adjusted him from the first moment after birth, after a home birth, with Bob Marley playing, incense burning in the tub. They come out of the tub, they're still connected. They get connected to mom, and a short time later, we check them and adjust it if needed. In that case, we might not need to. Those patients all fit my persona as a perfect chiropractic patient. And so a lot of times I'll contrast against the back pain patient, I'll contrast against the standard spinal insurance accepting decompression, shockwave sling in practice. But man, that kind of care is a whole lot better than surgery and opioids addiction as well. So it may not sound like it on the surface, and I should probably get better at being more clear, but I champion that kind of chiropractic as well. But I need to finish my last table setting point by saying this to you. If you're an expert in standard chiropractic and you're a badass adjuster of standard spinal conditions, musculoskeletal, sports injury, uncomplicated low back pain, cervicogenic headache, and all those things that, like Dr. Jeff Lang made, the evidence-based chiropractor, and most chiropractic clinics, most chiropractic schools, most chiropractic techniques, most chiropractic coaching groups, that's about where most of us stay. And when you master the art of getting results with those patients, that is fantastic. And you could go into the red ocean of where all the other chiropractors exist, and you can compete against other standard chiropractors. You could compete against The Joint. You could compete against all the other franchises. And you could carve out an incredible, impactful practice. And if you really busted your butt and you love doing screenings and you love $19 Facebook ads and everything else, you could probably find success in that model. But I finish this final thought by asking you, is that all you're called to? Or is there something inside your chiropractic freaking heart, soul, purpose that says, what if? What would it be like to truly take on the toughest pediatric, perinatal, and family practice neurological cases? What does it take to be a perfect storm Jedi, like a Dr. Tony, like a Dr. Matt, like so many PX offices out there who literally, so I'm recording this on a Tuesday because that's my content day. Yesterday, we onboarded patients from Dubai, from Scotland, and from multiple different states. So it's that clinical expertise in the toughest cases that actually allows our family wellness practice to thrive. The other thing I need to let you know is we have a massive family wellness practice. We have our dream easy street autopilot. We have 800 patients who are on wellness care every single week getting adjusted. Those are just wellness patients. Those aren't our new patients and our restoration patients. We have a massive family wellness practice in addition to the tip of our spear being literally now a worldwide brand taking care of tough cases. So I share my story there, not from a place of, oh, look at us, but to tap into your heart, your soul, and your original calling as a chiropractor and say, do you want that too? And if you do, awesome. Get excited, get stoked, get into this conversation and go, all right, I know what's been holding me back. I'm standard. I'm kind of like everybody else. I'm really good at it. But what if there's something more? What if there's another level of clinical badassity that I could step into? And what if somebody could give me a plan? What if somebody could illuminate the 5 things I need to do? And also, it's really important to shine a light on the 2 things you don't need to do to become an advanced clinical expert ready to take on tough cases. So this is that right there was my 10 or whatever minute intro, 11-minute intro into where chiropractic needs to get our crap together and admit that where we are isn't where we could be, and step into those things with humility and excitement and courage and our original calling to create a bigger impact, not just make more money and have better profit margins. By the way, taking on toughest cases will be the most financially lucrative freaking thing you could ever do in practice, okay? For our intensive patients, our OVA or dollar visit average, however you look at it, is it's like $180, $190 per visit. And that's chiropractic alone. That's not shockwave. That's not decompression. That's not white labeled supplements. They're not buying pillows and whoopee cushions or wobble cushions. What if they farted? What if they broke? Does it make a fart noise? I don't know, but that'd be funny. And so the truth is, it's not anything other than chiropractic that is giving that high dollar value. So I didn't plan on mentioning that. It's not on my notes here as I go through this one. But I will say this too. If you want that too, TOO, once again, in addition, guess what? Taking on the toughest cases is also the most financially, so it's the most impactful, I can't not say it in the wrong order. It's the most impactful, fulfilling, rewarding step up in your career you could ever do. And you better believe it will take care of you massively, incredibly, financially as well. So you ready? Get your pen, get your notes out. I've got 5 things. You got to go 5 for 5 on really, really crushing these things to be able to take on tough cases. This is not I ranked them. They're definitely kind of the most important first and in order, but it's a 5 for 5 thing. And then I think you're really going to have your mind blown by the 2 things not to do, because I think a lot of you are thinking, oh, there's actually a list of 7. I need to do these first 5, and then I definitely need to do those 2 things too, right? I need to add to chiropractic in order to get better results with tougher cases. Yeah, no. So be ready for that list as well. I mean it. Grab your pen, get rid of any kind of distraction. Okay, if you're crushing the elliptical right now, or you're out for a run, if you're out rucking, you know why I love rucking? 1, because I hate running, so I love putting on a weighted backpack. I'm also short and stocky with short little legs, so rucking out in the country here just makes sense. But actually, I'm going slow enough that if I'm listening to a podcast, I can pull out my phone and start taking notes. I don't pull my phone and get distracted by something else. I'm always in learning mode while I'm working out, so it's a double win. But I do love that too, because if I'm listening to podcasts like this and they're going to go through a list of 5 and things I need to do, I love learning not just concepts and excitement and inspiration, but I love learning strategy. And you probably do too, which is probably why you're thinking, okay, man, freaking get to the list. Let's go. But if you've been listening to the podcast, for any length of time, or me, you know that, hey, sometimes it takes me a little bit to get the old engines fired up into the step 1. Here we go. All right. Must do, must have number 1 is 10 out of 10. I'd actually like to really say 100 out of 10. Certainty, confidence, and courage that neurologically focused, principled, subluxation-based chiropractic is the thing that will move the needle the most in impacting that child or that patient's life. If you really dig into the science, the neuroscience and neurophysiology behind chronic illness, fill in the blank, put a condition here. I don't care whether you put autism or Lyme's or fibromyalgia or chronic frickin' pain syndrome into that blank. The depths of its root cause, the foundation of the challenge starts and stays with the central and autonomic nervous system being subluxated, dysregulated, dysfunctional, dysautonomic. So the nervous system being in disarray is the root cause foundational problem that is shared amongst all chronic illness. I believe it was Dr. Reggie Gold or someone of eternal awesomeness in this profession that said, you know what? Chiropractic doesn't cure cancer, but if I had it, I sure as heck would want my nervous system optimized and functioning at its best through chiropractic care. And what we really need to do as a profession, as every single I believe that every single chiropractor should have these 5 things in spades. I don't care whether you still, because that's your calling, want to have a standard chiropractic practice and really focus on back pain and chronic issues there, or you want to step into the pediatric perfect storm world like us. Wherever you go to take on tough cases, you need to start here and stay here with your certainty, your conviction, your clarity, and your courage to say, chiropractic care done, and I'm going to get to this with number 2 and number 3, done at the highest level possible, done with full expertise and application is the number 1 thing that will change this patient's life the most. Now, that is not in the absence of functional, integrative, nutritional intervention. That is not in the absence of fitness and physical activity or neuromuscular re-education and rehab. That is not in the absence of sometimes people need frickin' medication and surgery to put the fire out so that the rebuilding department, so Dr. Chestnut taught me this, hey, medicine's the fire department, they're pretty damn good, axes and fire hoses, and you know what, they save lives all day with the ambulance and surgery and medical doctors, but they're really bad at rebuilding that home that is half burnt to the ground. That's not who you call to come back and rebuild. So no matter what chronic case, tough case you're taking on, you need to know first that you are the best resource, the best option for that child to get out of that storm. And the way we look at this with PX and PX Docs and PWC and the perfect storm is we don't want to be option number 9. We don't want to be the last resort. We don't want to be the second to last resort. We don't want to be the 4th thing they try. What we will continue to push forth with the Experience Miracles podcast, which, by the way, if you don't listen to that one, you're not a regular listener, you haven't downloaded and connected to that one, that is our parent-facing, literally reaches worldwide. The 3rd most listened area for the podcast is in Australia. The 2nd most listened area for the podcast is in the UK. So that podcast reaches the world and says, hey, we are the best option to get your child. We really focus on tough cases, autism, epilepsy. There's a lot of episodes about that because we know that those families are looking at us, unfortunately, today, most of the time, as a last resort or a later resort instead of the first call, first choice. But if we all collectively, chiropractically had the conviction, and then I'm going to get to number 2 and number 3 next, which is the clinical training and the skill set to get the results, not just know that we can, but be able to take the action steps required clinically to back up our conviction and our courage to speak out and say, hey, you belong here, get here. If we all did that, then we wouldn't be the never resort for people that don't even know we exist. In fact, chiropractic's biggest problem is obscurity, or just late to the party, being last resort or second to last resort. And so the number one thing that is an essential first step is to understand that the perfect storm is the number one thing causing kids to be so sick. It's not just toxins. It's not, we'll go in order. It's not just what medicine said. You know that, right? It's not just genetic, but it's also not just bad gut health. It's not just retained primitive reflexes and a disrupted microbiome and parasites that love to throw a hellacious party during full moons. It's not just those things. Subluxation, nervous system dysfunction is deeper and showed up before than all that. When you look at fertility and maternal distress, birth trauma, those show up first, number 1 and number 2 in the perfect storm algorithm, before toxins, Hep B shots, antibiotics, and other vaccinations even show up. We're not throwing out and dismissing the toxic assault from Cheez-Its to vaccinations that are causing our kids to be chronically sick. We're not just going to say that's all it is. It's not just heavy metals and vaccinations and antibiotics and poisons in our freaking water. Those are all nasty issues, but subluxation is nastier, and it shows up first and earlier. And so if you don't know that with certainty and conviction, if you can't put together the perfect storm workshop as well as I can and deliver it to the world, then moms are going to know, he or she sounds like they might be able to help, but I wonder if they're just guessing. I wonder if they're just faking it till they make it. So write this down. In addition to this one, kind of a sub-bullet point of step number 1. This is not a practice model where you can fake it till you make it. If you have ever in your life had a coach or a mentor or a professor or anyone say, you know what, in practice, you just need to fake it till you make it, run as fast and as far as you can in the other direction from that coaching and that mentorship. That is one of the biggest loads of BS. When I was early in practice and I knew that I wanted to, 1, shift from my standard premier wellness, sports injury, back pain, neck pain, kind of, standard management, chiropractic school graduate practice, that's all I knew. And then God called me to pediatrics and called me to prenatal care. And then he called me to tough cases, perfect storm, and autism. I didn't fake it till I make it. That's the last freaking thing I did. I sat in freaking weekend seminars relentlessly. I researched relentlessly. I read relentlessly. I went out and got mentorship from Dr. Cody and Dr. David Fletcher and all sorts of other people relentlessly to be able to get incredible results. I did not for a second fake it till I made it. I made it so that I could make it. So, number 2, the other thing you need to thrive in taking on tough cases is you need advanced, in-depth, ridiculously focused clinical chiropractic training. Now let's open the lid. Let's open the hood here to what that means. When I say the net word clinical, I'm not just talking about adjusting. Adjusting is obviously the end point. If you don't master it and absolutely have it down at 100 out of 10, you will not experience miracles in practice. But adjustments, singular, are not where the magic of taking on tough cases really resides. It's in care planning, adjustments, plural. And so the first thing that people forget about all the time when they look to step into clinical mastery of any kind for any condition or any patient cohort is, what does the case management look like? What does the ideal care plan look like? Did you know I talk about this a lot, but I can never talk about it enough, because the biggest weak point we have as a profession in taking on tough pediatric cases, and just pediatric chiropractic as a whole, is not our lack of adjusting skill set. It's not that we missed out on pediatric adjusting techniques. It's that we don't know how to properly care plan and case manage and assess analyze, interpret, and then communicate with conviction, with clarity, and with value to the parents why this higher frequency by a large margin, longer duration by a large margin, cash pay, because insurance, if you're accepting insurance and you're billing for kids, you're cheating the system and you're putting your own career at risk, because there is no code and there is no modifier that insurance pays for subluxation. So if you say you're a subluxation-based chiropractor and then you accept insurance, at least in that one place, when you hit submit and send that in, there goes that. So, because it's treatment. I believe, I haven't been in this role for so freaking long. Doesn't CPT mean procedural and treatment code? So if you're using those codes, you're saying you're doing what they do, which is not what chiropractic does. So I digress. But the truth is, this advanced in-depth clinical training means that clinically, you're the full package. I always love to kind of use this analogy for, if you've ever played a video game, a sports video game like Madden. Madden is the most popular one, the football one. They give players rankings. They give them these composite scores, these net composite scores as to how great of a football. It's a scale out of 1. It's like your kid's getting, the standardized test, right? They grade it out of 100. If your kid's a 99, holy heck, right? I don't think you actually do 100. But if you're a 99, you're at the best. Well, that's the same in Madden. So if a quarterback, is at the best, that's the score they get. But also, it's a composite score. So stick with me on this analogy. There is individual components. Like a quarterback would have arm strength and accuracy and kind of, I don't know what I haven't played Madden forever. I'm a little busy being a dad and serving and serving through our mission to play video games. But I believe kind of like field awareness, accuracy and decision making. We would call that clinical decision making and case management in kind of the quarterback, because you do play that role too. You're not just the adjuster. You're the quarterback. You're the play caller. You're the head coach. You're the GM. And so advanced clinical training actually fits this Madden mentality because to get a composite score of 99 and to be the elite advanced chiropractor that these tough cases need you to be, you can't just be a great adjuster. You need to be a great analyzer. You need to be a great case interpreter and to be able to see the forest through the trees. And in these complex cases, really being able to put the care plan together and really being able to choose the primary and major subluxations that need to be adjusted first and only. And then that's the perfect segue into number 3, because number 3 on my list of 5 things you must do to be able to get world-class experience miracles results with tough pediatric and any clinical cases is you need to be proficient in a multitude of chiropractic techniques. This one I chose to give its own line item because no one else teaches this outside of PX. Yes, other pediatric certification and diplomate programs teach a multitude of different techniques. I took all them. I'm certified from there. But they never once for a single hot second said, these clinical cases over here, or more accurately, because I want to really teach you the good stuff here, these specific subluxation patterns and neurological presentations. So forget conditions. This isn't medicine. We can't say, hey, for ADHD, use this technique, and for ear infections, use this one. For this specific neurological pattern, subluxation dysfunction pattern, you need to choose this cohort of techniques. And for these specific subluxation patterns and these depth of patterns, you need to choose these techniques. Now, on the surface, as a practicing chiropractor, that shouldn't sound too confusing. But it should sound brand new and novel, and that sucks to admit as a profession. Because somewhere along the road, and I don't know, I'm not a chiropractic historian, so I don't know where this would have come from. I can kind of surmise and guess because it's the easy path. And outside of the library at Palmer, one of my favorite BJ Palmer quotes was there. It says, the path of least resistance is what makes rivers and men crooked. And chiropractors, like every human on earth, this isn't just us, we tend to default to the easy path. And you know what's easy clinically? To choose one singular technique, master it, and then put every single patient through that technique and that technique only. So those of us that have done that, and I certainly did that early in my career, I took the same path that pretty much every other chiropractor does. And at first it was Gonstead. I was in seminars in the basement at Mount Orab all the time. I was literally in club, never missed a meeting. I stepped into leadership. I shadowed offices. Like I was on my path to master Gonstead practice. And what reverence and respect and incredible clinical results does Gonstead get? It is as elite of a technique as it gets. And then through my internship, I was exposed to tonal, to TRT, to MC2, to all these different, to Light Force DNFT, to Papa Marv Tulski, and all the different ways that tonal light force adjusting can be done. And right there, literally just a few feet away from me on my internship, I saw patients get miraculous results with as a Gonstead student, an aspiring Gonstead doctor at that time, what looked like to me not a damn thing happening, right? What looked like to me like, you're barely doing anything. And not only did these patients come back and report incredible changes in their lives, it wasn't just symptom condition, it wasn't a placebo effect, that's for darn sure. Because also during my internship with Dr. Cody, who's really going to get the shout out here for teaching me number 2 and number 3 and being my absolute saving grace to teach me that in order to be a pediatric chiropractic wizard like Dr. Cody was, and to really take on these tough perfect storm cases, I couldn't just adhere to a singular technique, but I also ran scans, and I did the progress scans, and I did the progress objective, not subjective, evaluations from these patients. And whether Dr. Cody had a patient where he would choose to, as I like to kind of say in my Tony Iowa way, bring out the hammer. See, Dr. Cody grew up Palmer. Dr. Cody grew up Gonstead. Dr. Cody could, quote unquote, move a bone. I love when people are like, oh, I do tonal adjusting, not osseous. Well, osseous adjusters aren't just moving bones. It's all more alike, every single technique that we all do. And the people who are the most purist in their certain technique do not like it when I say this, but I am in clinical practice. I don't teach a singular technique. So I can see the forest through the trees and speak to the truth in its expanded presentation, not its limited presentation, based upon the blessed viewpoint that God has given me. And I can tell you this, the majority of our techniques, whether you're bringing the hammer, like setting a T1 in the chair, Gonstead, or you're going crazy light, toggle, integrator through the finger, Papa Marv, Talski, and barely, just opening that window and getting through it and letting the nervous system, that's a better place, a safer place, calmer place, more balanced place to be. No matter what technique approach you are taking, they are more similar in terms of how the nervous system receives processes and what the nervous system does with that input. They are more similar than they are different. Now I know right here in the middle of this episode, I'm probably stepping right, I'm climbing all the way to the top of the chiro blasphemy tree and being like, what? How can you say this? Because we freaking love our techniques. Do you know what I love? And here's why I can say that. Calm the noise right now. Please hear me on this one. And get rid of all your chiropractic past and what everybody else, has said to you. And please just, hopefully this one lands for as many of you as possible. The reason I can say that is because I don't care about anything other than the patient on the table and the child or the parent or the patient in front of me. Everything I've done from day one to this day, to the day that God calls me up above to celebrate and live life in heaven with Him, I will work for them, not for chiropractors, not for the recognition of, some status in chiropractic. This is the best technique. No, chiropractic is the best, period, in healthcare. What is the best way to deliver chiropractic? By being a master and proficiently being dialed in, all in on a multitude of techniques, and then knowing, hey, for this particular case, this kid's specific subluxation neurological dysfunction pattern, the very best thing for this kid with this adjustment at this segment, at this stage, and this phase of this care plan is to go very, very light. And then you're going to walk into the next room, literally 3 seconds later, and you're going to look at that kid's clinical presentation. You're going to look at that kid's subluxation analysis. You're going to look at that kid's neurological pattern, and you are going to accurately, if you're doing this job with advanced clinical badassity, you're going to look at that child and go, you are in stage 3 neurological exhaustion, and I need to bring the heat. I need to bring the hammer. I need to set this adjustment with a Gonstead cervical chair. I just did a C5 Gonstead neurotonal HVLA adjustment on a 14-month-old child yesterday and got a report back from the parents because this child had been stuck developmentally. This child had been stuck in sleep. This child had been stuck not making their motor milestones. This child had been stuck not eating. This child had been stuck neurologically in life, and we had gone light and we had gone easy and we had gone to occiput and we had gone to sphenoid, we had gone to C1, we had gone to the CT junction, and we ran our inside scans, the key component of step 2, in-depth analysis, and it was the most obvious needed subluxation ever, C5. And when I looked at Isla's entire clinical case, it was the easiest thing in the world to say, this is a chronic, deep, exhausted subluxation because this was a traumatic birth, cord wrapped HIE kiddo. So I cannot take it easy on this C5. This C5 needs to be gone now. And that's how it got adjusted. Not because I'm a Gonstead doctor or because I'm a TRT doctor or because anything says any specific technique on my certain polo and the certain seminar that I only attend and I bash all the others. Nope. I cheer on every freaking one. And when I walk into clinic every single day, when I walk in to serve my patients, I walk in with a tool box. Not just my pisiforms, not just an integrator, not just an activator, not just whatever, not just a drop table, not just my thumbs. Shout out to my Loganators like Dr. J. Coleman. We are ready for whatever that child needs. So that's probably the longest on this podcast I will ever go about this very specific component of chiropractic clinical advancement, which is really being proficient and mastering multiple adjusting protocols. But I wanted to go deep and I wanted to go long on that one because I don't believe I've touched on it much at all on this podcast just yet, if I have only lightly. And I wanted to go deep and I wanted to go long on it because I knew it would be mind-blowing because I've taken every other seminar and every other certification and every other technique out there, and no one talks about how effective the whole of chiropractic is. Everybody loves to, and they should, talk about how effective the individual technique that they love, they teach, they use is. I just have always seen something bigger for chiropractic, not for us as chiropractors, because that's not why we exist, but for them as patients. And when you care only about what gets them the best results, well, then you put chiropractic's limited history to the side and you say, what is the next level of clinical mastery? Multiple techniques, not singular. Okay, number 4 and number 5, for the sake of the totality time of this podcast, and I hope you're taking notes, I hope we're blowing your mind, and I hope you are now firmly on the path to what it takes to take on tough cases, what to do and what to avoid. I'll be a little more brief with number 4 and 5. I mean it, I really will. Not because they're not essential, but we really, again, all 5, you got to go 5 for 5, but the first 3 we just covered are really essential, and 5 really blends into number 2, the 2 things that we don't want to do. So number 4. You got to build a tribe around these patients, around these parents, around these families. You need an all-in, supportive, empathetic, empowering CA, associate doc team, and supportive community. Tough cases and their families need community almost as freaking much as they need chiropractic. Now, if you just got done listening to the last half hour of this podcast, you know how much I know they need chiropractic. And an advanced, in-depth, blow your mind, expect and experience miracles level. That's how important community is. The fact that I would verbally put community right nipping on the heels of how valuable chiropractic is to transform the function of that kid and that patient's nervous system. Well, we got to get them out of medicine. What kind of community is the medical doctor's office, the pediatrician's office? What kind of community is a traditional social media platform? What kind of community is the cul-de-sac and the other soccer moms who are like, just give them more antibiotics. Oh, there's nothing you can do. Just got to accept it. The medical community has taken hope away from these people. The medical community has given them no empowerment. The medical community and the regular frickin' traditional media world has given them no hope, no empowerment, no education. And what they did educate them on is a gaslighting fricking lie. They told them there's nothing they can do. They told them, don't worry, they'll grow out of it. They told them that they didn't tell them anything about subluxation, nervous system dysfunction. They told them that nutrition and living their, stopping vaccinating and living a healthy life didn't matter. So you get to build an incredibly empathetic, engaging, empowering support community. And you can take this one to the bank and write this down on your notes. What does that look like? So a great mentor of mine also, again, I'll never do a podcast where I don't shout out. Hopefully, if I had my way, I would teach this stuff, and every single time, every one of my mentors' names would be put front and center on this because I'm only here because of them, okay? God put them in my life. I had the humility mixed with the opportunity to sit down, listen, and take what they taught me. And then the most important thing, which I hope I am giving you the opportunity to do, and then I put it into action. And you know what? They were all right, and this stuff works. So Dr. Lyle Coach, a shout out to the Omaha legend. Speaking of a world-class Gonstead doctor right there. So Dr. Lyle Coach had taught us this way back during the heyday of Epic, when Epic was really crushing and cruising, which was a pivotal, impactful moment in my life and so many chiropractors' lives in this movement as a whole. So much reverence for those days and those times. And one of the first seminars I ever went to with Epic, and Dr. Lyle was one of the top tier coaches there for a short season. And he said, if you really want to build a family practice, do this. Build a community within your community. You don't need to serve everybody in Omaha. You don't need to serve everybody in Crystal Lake. You don't need to serve everybody in Rhode Island, if that's where you're listening from, or Bolivia, shout out if you're way down south. But you do need to build a tribe mentality and build a community around your people. So I'll leave that one at that level, but a book recommendation to go with that one. Seth Godin is more known for kind of like marketing strategy and everything else, but he has a book called Tribes. And if you have not read the book Tribes by Seth Godin, right now, when you're done, go on Amazon, read that book, and then apply it to your family practice. And number 5 of the must-do list will literally blend us right into the 2 things not to do, and we will be done with this one. You must have, in order to get incredible clinical results with tough cases, you must have an ability to stay in your lane. You can write this one down as focus, F-O-C-U-S, big bolded letters, I can talk. You must have an unrelenting, undeniable, relentless, obsessive focus on chiropractic and chiropractic only. Pretending to be that child's nutritionist, physical and occupational therapist, eye doctor, vision doctor, ABA therapist, life coach, pretending to be something your initials are not is not what gets you better results. One of the biggest freaking gaslit lies that people are told in pediatric chiropractic is that in order to take on autism, neurological brain-based cases, you need to add to chiropractic. You need to complicate it. You need to dilute it. You need to distract yourself from clinical badassity and excellence. That's not the path to advancement. What's wild and mind-blowing is that most certifications and diplomate programs are simply filling hours with non-chiropractic things because they have to. Because in order to get a certification status, in order to get CE credits, you need to kind of put all this academic, medical treatment, kind of mumbo jumbo party tricks in there. And if you package it just right on Instagram and on your landing page and on your presentation, you can say, hey, all of this is required to take on these tough cases. It's only required if you're not that good at chiropractic. I just said that out loud, didn't I? When you get better, all the way better at chiropractic and chiropractic only, you are now the best in the world at repairing, restoring, reorganizing the central and autonomic nervous system, because that is the lane. When we write this one down and we say stay in your lane, what lane are we talking about? We're talking about the most powerful, impactful, and this is proven through neuroscience. Look at Dr. Harvick's research, look at everything we do with PX. I can show you the research behind this, and I have not only the clinical research, the research that goes up in white papers, most importantly, white papers pale in comparison to the realities that clinical experience teaches us. And I bought all this BS hook, line, and sinker. When I went out, I was functional this, integrative that. If you would have walked into PwC circa 2009, 2011. There was a PT, OT. We were doing visual accommodation issues. We had a functional nutritionist or whatever the frick they called themselves coming in and doing stool samples and lab work and hair analysis and selling people thousands of dollars of supplements. I freaking put a pediatric PT and OT on staff. And we had a sensory gym and the wobble boards and the freaking tape down the center and all the eye testing and primitive reflex party tricks. We did it all. And do you know what happened when we did all of these things in addition to chiropractic, but did not get better at chiropractic? We did not get better results. We got worse results. The more I added to chiropractic, the less our results took root and changed a child's life. Not only subjectively from the parent reports and the paperwork, but most importantly through our thermal, EMG, and insight scans. As I started to add other therapies and services, which all these certifications, teachers and preachers and people told me, in order to advance the clinical results you get with these tough cases, you need to add to chiropractic. Of course you're gonna do chiropractic. Chiropractic is great, but you gotta add to it. And I was like, oh, okay, I didn't know, I'd never done it. So I did all that. I remodeled my whole clinic, added it all. And what happened first, when I added a few things, like the primitive reflexes and the neurointegrative therapies, is our results started to plateau. they started to go a little slower, and then they started to plateau. They didn't necessarily tank. And then the more I added early and often and right away, and write that if you really want to learn what I'm saying here, it's not that these things are bad. It's not that obviously PT, OT, speech therapy, detoxification, functional medicine, supplements, diet changes. It's not that these things are not going to help a child heal, recover, and get better. It's what order and what priorities do you have? Do you understand? This goes all the way back to number one on our list. If you actually fully understand the neuroscience behind the perfect storm and what causes kids to get sick, those secondary and tertiary dysfunctions of retained primitive reflexes, brain hemisphericity issues, incoordination, visual accommodation challenges, those are all secondary compensatory mechanisms from, write this one down, subluxation. So if you step up, become a world-class, all-in, advanced clinical chiropractor who can slay, clear, and annihilate subluxation, not just through a singular adjusting technique, but a multitude of adjusting techniques matched perfectly to that patient's needs. And in order to be a full-throttle subluxation slayer, you're not just a great adjuster. Most importantly, even more importantly, you are a world-class care planner, and you know what recommendations to give that kid, frequency initial and duration overall. Now you don't need anything else because nothing else compares to chiropractic. Two things not to do should be straightforward and forthcoming based upon number 5 that we just filleted. You do not need to oversee their diet changes, their detox protocols, their supplement routines, their sleep schedules, how many ounces they're eating, what their latch looks like, what baby carrier they're using. Oh, did you invest in this car seat? What kind of chemicals? What paint are you using to paint your house? Is it VOC free? What baby pillow do you use? What sheets are you using? Did you get bamboo? Are your child's bed covers mixed with bandu and paprika? I have no idea. Paprika just came to mind. Seems like a bad thing to sleep on. But what the heck? How are you going to do all that? You're going to see 4 patients a week and be everything to everyone? You don't need to do those things. What you do instead is you build an entire collaborative network of other professional badasses. Pause right now and just think of this. Think of how easy this is. But first off, it's a very difficult, not fun, watered down path to try and be the frickin' nutritionist, life coach, physical therapist, eye doctor, vision therapist, everybody to all these kids. I tried it for a season, and if I ever got close to burning out, it's when I lost track of chiropractic because I tried to be everything to everyone and build this big wellness, multifunctional, functional, neurological, integrated clinic. You don't need to be their functional provider. You need to be their chiropractor. But what you can do to build your practice, incredibly, is you can build a network of other badasses whose calling is purely in their lane. Yeah, pause right now. How many patients do you have? How many moms do you have right now who completely transformed their kids and their family's health, not just through chiropractic, but yes, through lifestyle and nutrition? And how many of them have an Instagram page? How many of them did not go to school for 8 years, did not accrue $200,000 to $300,000 in debt, and have an Instagram page with more followers than you, and sell courses and coaching, and are, maybe they even have a dietitian degree. Maybe they went out and got, how many different, I believe 3 out of our 8 or 10 CAs have some sort of functional nutrition, certification, quote unquote, degree that they took online. And by the way, I'm not putting these things down. I'm just contrasting them against chiropractic. You went to school for 8 years to be a doctor. You don't have to go to school for 8 years and be a doctor to sell supplements or work on all these other sort of things. So why in the world would you not just build a Rolodex and a network of other experts who are absolutely owning their lanes? And guess what you do? When your patient's nervous systems are getting better and they're reaching what's called neurological stability and they're ready for additional, remember, do not do this early. You want clinical mastery? Don't do everything all at once. That's not how an overwhelmed, dysregulated nervous system will just get further overwhelmed and dysregulated by doing too many things at once when it's subluxated and discoordinated. So get the nervous system better first. Minimum 90 days. Write that down. Don't add anything else to this child's healing plan for the minimum of 90 days. Complex cases, we don't do anything for 6 months. When we do, we don't do it. We refer out. It's like the Part 4 board's answer, just remodeled into a perfect practice. We refer out to a pediatric PT who's better at PT than we are because they went to school for it. We refer out to well-rooted for functional medicine when that kid needs to get the heavy metals and the parasites out of their gut because they freaking went to school for it and they do it all day, every day, and I don't, so they're better at it. And I'm busy doing what I'm doing. They're busy, they're doing what they're doing. We refer to them, boom, new patients, grows my practice. Sorry, we refer to them, new patients for them, grows their practice. They love us. They love us so much because we're giving them these not only referrals, but these well-adjusted, ready to respond to their care better than ever patients. So what do they do to us? They refer patients to us like crazy. You want to build your practice Don't play PT. Don't play nutritionist. Don't play life coach. Don't play supplement salesman. Be a chiropractor only. So number one on this list of what you don't need to do and should not do is absolutely just an extension of number 5, stay in your lane, the list of what to do. And you also within your exam, and I want to get to the end of this one for you guys so you can get to work doing these 5 things and not doing these 2 things, but you do not need to spend time in your exam checking primitive reflexes, visual accommodation, and other brain-based checks. Okay, the eyes, the brain, those are just parts of the nervous system. If your analysis, your exam is purely, entirely advanced and in-depth finding subluxation, nervous system dysfunction, dysregulation, and dysautonomia, you have found everything you need to do. If your case history, your insight scans, you can't do that without insight scans. You absolutely positively must have insight scans, neurothermal, EMG, and HRV. And then we teach in our certification program through and in conjunction with Life University Postgrad Department, the only one where they don't just give us CE credits, but they're literally putting their name and their backing behind our certification. So it's not just me saying, hey, look, this works, but it's a literal accredited university that says this is the best program out there. What we teach through our 5-step neurotonal analysis is the deep dive into the case history. We teach the insight scans and the functional measurement and quantification and location hunting of insight with the insight scans of neurological dysfunction. But we teach you how to do a very simple, it can literally be done while the kid is playing in the toy room, a very simple movement-based, just really in coordination, postural distortions and spotting subluxation patterns and primaries that way. And then we teach a really pediatric, perfect storm, tough case friendly way of palpating and evaluating, because when you take on tough pediatric cases and they're more neurologically subluxated, they are more sensitive, they are much harder to do any kind of exam on. So you need to take the difficult cases and you need to find the most simple, straightforward path. The most complicated path, trying to mess around with PT, OT, eye doctor exams like primitive reflexes, visual accommodation, and all these other brain-based checks. I know it looks fancy on Instagram. I know it might look cool to parents, but that's all it does. It actually distracts and dilutes your examination, your annihilation, and your conversation and communication around subluxation and what chiropractic can do only. And I think I probably said exactly that or some version of it 77 times throughout the course of this episode, which is exactly what I intended to do. That's the through line. It all starts with number 1 of our list of things to do. When you really study the neuroscience of the perfect storm and subluxation deep enough, the opposite of that then also, that's the bad, that's the storm, that's the negative. So that means the opposite is true. When you really truly master then annihilation of subluxation, nervous system dysfunction, and dysautonomia at its fullest, in its most advanced form through chiropractic only, those are the greatest, most powerful transformative results. Nothing else can hold a candle to that. No, I love PT, I love OT, I love functional medicine, I love supplements, I love detoxes, I love all that. None of it. Literally, if you look at the science and if you look at the clinical experience of true masters like Dr. Cody, Dr. Fletcher, Dr. Elbert, who taught me, and now, thankfully, 17 years, with humility, because I care so freaking much about the results for these tough cases and kids and patients through this profession, I can say confidently that I'm there too. You can trust me on this one. The list of 5 things that we do, that is front and center what puts PWC literally on the map, where patients fly here. And in the last 6 months, we've had 6 patients move here from out of state to literally set up shop and move their whole family here to continue to get care here. Not because we play PT, not because we help them with their supplements or decide what essential oils to put in the diffuser, because nobody does chiropractic better. If you have been waiting for chiropractic to take you by the collar and say there's more here, well, that's why God called us to put the Family Practice Podcast together. And that's why God really called me to put this episode together, to call you into the arena and say, chiropractic is the most kick-ass thing. You won't get bored, you won't get burnt out, and you won't sell out if you step up and you take on tougher cases. Go back, go through these 5 things, make sure you go all in. You need help, you know where to get it, PX. Sign up for the CERT course, get after it, join us at the seminar. And if this spoke to you and you need any kind of personalized help, you don't know, oh man, I'm stuck here. I could just use help putting together a plan. I could just use help in addition to this episode and this podcast, adding clarity as to what the next steps are. Will you send us a DM? Just reach out to us on Instagram or Facebook or through our website, www.thepediatricexperience.com. We know exactly how to reach out, give you a hand up, push you, pull you forward and say, hey, there's a path to even more incredible chiropractic results, even for tough cases. And what's going to happen is you're going to have the greatest experience ever as a chiropractor, because the most fulfilling, rewarding, impactful, and financially fruitful thing I've ever done in my career is step up and take tough cases. And I want you to do it too. Hey, Dr. Tony here, and I wanted to say thank you for listening to the Family Practice Podcast. If you enjoyed this episode, like and subscribe to the show so you don't miss a thing. Also, if you're looking for more content from us, you can absolutely subscribe to our newsletter, watch exclusive episodes on YouTube, and dive deep into the articles and blogs on our website. All of this is linked in today's show notes. Thanks again, and we'll see you on the next episode.